Thank you, Chairman Davis. I appreciate you holding this important meeting today and on how to address child poverty in America. First, I do want to acknowledge we're all thinking of those impacted by the coronavirus across the country, and especially those in my state of Indiana. I want to thank the witnesses for still being here today, despite the travel issues that we all had, but I'm grateful that you're here. I'm glad this subcommittee's been able to work together on a bipartisan basis to help families in need. Most recently, passage of the Family First Transition Act, which the President signed into law on December 1st. I hope we can continue to work together on this important issue as well. Overall, we have made incredible strides when it comes to alleviating poverty and expanding opportunity in America, but even one American child in poverty is too many, and I think we all agree. We know poverty has had many detrimental outcomes for children and affects families, communities, and society as a whole. Thanks to pro-growth policies like tax reform, unemployment is at a 50-year low, median household income is increasing, and workers and families in every part of our economy have enjoyed a share of prosperity. With incomes rising for Americans, the poverty rate is at its lowest since 2001. We're lifting families out of poverty and moving them back into the front lines of the labor market, empowering people to have better lives. As we discuss ways to reduce child poverty, we can't ignore the vital role of economic growth. We're seeing that opportunity can do more for child poverty than any government program. Our goal should be to fuel self-reliance through work and opportunity that allow people to pursue their American dream. Over the last several decades, federal spending on programs targeted toward children has increased substantially. According to the Urban Institute's Kids Share report in 2018, federal expenditures on children in poverty totaled more than $485 billion. The social safety net is needed to help those who fall in hard times get back up on their feet, especially families with children. The question is, how well is it working? One of the reasons I helped launch the bipartisan What Works Caucus is to make sure taxpayer dollars are invested in programs that are backed by evidence and data. Rigorous evaluations of anti-poverty programs will improve outcomes of children, families, and communities nationwide. For too long, there's been a lack of accountability and evidence as to which programs actually work. Even when there are alarm bells about accountability, existing spending is usually not questioned. For example, the Temporary Assistance for Needy Families, or TANF program, has been extended 42 times with no changes, despite evidence of widespread misuse of funds by states. We can't keep kicking the can down the road on TANF. Poor children suffer when TANF funds are allowed to go unaccounted for and repurposed to fill state budget gaps. Another example is from a recent evaluation of the Health Professional Opportunity Grants, or HPOGs, program, which showed no impact on employment or earnings of participants. If we're serious about reducing child poverty, we need to be vigilant stewards of taxpayer dollars. We can't afford to continue to fund ineffective programs and then fail families. That's why Republicans on this committee have supported a comprehensive reauthorization of TANF through the Jobs for Success Act. Our goals are to better target funding, improve state accountability, and strengthen the focus on reducing child poverty. We also want to support proven programs like the Maternal, Infant, and Childhood Home Visiting, or McVeigh program, that relies heavily on evidence-based intervention and has demonstrated incredible results, including in my home state of Indiana. I hope as a part of this discussion on reducing child poverty, we don't lose sight of improving the effectiveness of investments taxpayers are already making. I look forward to the ways we can work together to help the overall well-being of children and use this as an opportunity to harness the power of evidence and data to ensure we're investing in what works. With that, I yield back, Mr. Chairman.
Thank you, Mrs.